What are the limits to natural medicine? Natural medicine is not necessarily appropriate to diagnose Western medical conditions. That's not its emphasis. The emphasis of natural medicine is to treat the individual patient. So in other words, natural medicine treats John with IBS, not necessarily the IBS. Natural medicine doesn't replace essential medication. People that were already on high blood pressure medicines were not able to get off their high blood pressure medicines. In some cases, if they had high blood pressure and went on herbs first, they were able to control the blood pressure naturally. But in most cases, when they were already on blood pressure medicines, they could not get off of them with natural medicine. Don't look for immediate results with natural medicine. People sometimes say that acupuncture doesn't work. And in my experience, most of those people go to an acupuncturist once. And so to give natural medicine a fair trial, you have to realize that natural medicine works more gently and more slowly than Western medicine. And then finally, natural approaches won't necessarily overcome genetic predispositions. So earlier I talked about high blood pressure. In the United States and Canada, many people, if not most people, have genetically based hypertension. That is, they exercise, they have a good diet, they have normal weight, and they still have hypertension. And that's because it's been passed down through genetics. So it's important to realize that by using herbs, we can't necessarily change their genetic makeup. So it's important to realize that natural medicine is really part of preventive medicine, which includes a nutrient-rich diet, regular exercise, and Western medicine when necessary. If you'd like to see more videos like this, please be sure to like and subscribe. This would really help us grow our channel. Thanks for joining us, and we'll see you next time.